The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering bioidentical hormone replacement therapy. With us, we have an expert on the topic, Dr. Nancy Vance. Dr. Vance, welcome to the program.
Thank you, Randy.
Now, before we get into today's topic, and we're talking about natural hormones.
Correct.
Tell me a little bit about, let's start with your background and your training. Very interesting.
Okay.
In the emergency room, board certified in emergency room medicine.
Yes.
Okay.
Yes. Well, back just a little bit. Before I became board certified in emergency medicine, I actually went to school very late in life. 32 years old. Decided I need more meaning, decided I'd go to medical school.
All right.
Loved everything. I loved endocrinology, oncology, neurology, and found myself wanting to be an emergency medicine physician. And I did that because I wanted to...
You don't look like an ER doc, by the way.
Oh, well...
Except for some of the ones on TV. You look like
yes,
those people.
That's what I was going for, yeah.
Okay.
I thought I could save lives. I thought I could change lives. And in 10 years of practice in the emergency department, I did save lives, and it was wonderful, but I didn't feel like I changed any lives. I became very much aware of is that we were doing a very good job of extending life, but we weren't doing a very good job with quality of life, and that we needed to be addressing this upstream. We needed to be taking care of.
You want to get these people earlier?
Absolutely.
What's a typical patient? I mean, describe the kind of patients that you see.
Typical patient is hard. I'll give you some examples, or we'll group it a little bit.
Okay.
There are those patients that are 40-ish, 45 years old. They're used to feeling good, they're used to looking good, and they're not. They don't feel near as good as what they look on the outside. And they are starting to have symptoms. And they're starting to get that fatigue. You know, they're starting to increase their workout. They're starting to diet. There isn't anybody, Randy, right now who doesn't have access to information on weight loss.
Okay.
But we're still not losing weight.
All right.
We're still gaining and gaining and gaining. And these are women who, they keep trying more. They keep dieting more. They're exercising. They're doing all those things they need to do. And it's getting harder and harder and harder. And the weight keeps coming up and coming up and coming up. So these are the women that come in, and they're sophisticated, and they want to know, why is it now at 45 they can't lose the weight like they did at 35?
Okay.
So that's one group. Here's another group. These are premenopausal or menopausal women, and they are very entrenched in their symptoms.
Like?
Oh, gosh. Hot flashes, night sweats, not being able to sleep, fatigue, can't concentrate, gaining weight, irritable with their husbands. In fact, you know, they're irritable at work, they're irritable at home, they're irritable with their kids.
Do they tell you that? I mean, they come in and say...
Oh, they say they'd like to strangle their husbands. That's the most common...
And that's hormones.
Oh, yeah, that's hormones.
Okay.
Yeah. When you go looking at your husband from affection to wanting to strangle him, that's generally going to be hormones. And actually, sometimes the husbands are the ones who bring their wives.
Is that right?
And absolutely, absolutely. But the second group are those that are really entrenched into those symptoms, and they're suffering, and they need help.
Okay.
So there's a third group, which I always kind of find interesting, and they're the professional people. They're the people who need to have that edge. They may be CEO of a company. They
like a
may
type
be
A type of
Oh yeah, type A personalities, and they're out there competing. So whether they're in an athletic competition, or they're competing for jobs, or maintaining a business, they want to keep that edge, and they know that to keep that edge, they need to be hormonally balanced, they need nutrition, they need energy, they need their motivation intact.
Okay.
And maybe a fourth group is people who have some kind of issue. Now, it may be that they're concerned about heart disease, diabetes, they're concerned about Alzheimer's, and they just want to be proactive. They want access to that sophisticated test, maybe even genetic testing, that they can develop a plan so that they aren't subject to those age-related declines.
Do you believe you could have an impact on that? I mean, somebody that breast cancer runs in their family, or heart disease runs in their family?
Randy, let's take breast cancer. Breast cancer doesn't suddenly come and tap you on the shoulder and say, here I am. Breast cancer has been developing for 7 or 8 years. So we need to, modern medicine or traditional medicine says, well, let's take a mammogram and let's catch it early.
Okay.
Well, yeah, that's great, and we should be doing that. But what about keeping the woman hormonally balanced, keeping her nutritionally sound, keeping her weight off, doing all those things that puts her at a less risk for developing in the first place?
So is your philosophy that you can make people live longer with bioidentical hormones and nutrition and stress reduction and those things?
Absolutely. Those are the things that lead us into these chronic disease states. These things, we're not, at 20 years old, when we're hormonally balanced and our hormones are even at their highest, that's not when we get prostate cancer, breast cancer, when we get heart disease, when we get Alzheimer's. It's as we lose our hormones, as we get older, that we start to be subject to these declines.
Okay.
So, right now, 50 is a wonderful age. If you are a 50-year-old right now and you reach this age relatively intact without any major diseases, you have the potential to live a healthy life well into your 90s.
So what are you doing though? So I understand this correctly. Okay, so as you get older,
yes,
your hormones are doing what? They're declining?
Your hormones are declining.
Okay.
And you got to remember, the hormones are like a web, and if one goes down, it messes up the other one. You can think of it like a symphony. If one instrument is out of tune,
okay,
you can't play beautiful music. And the truth of hormones is, it's that hormonal web. One does affect the other. If one hormone declines, it affects the other hormones. They also are out of balance.
So are you trying to get their hormone levels to, when like a 45-year-old woman comes in with all of these symptoms that you talked about?
Right.
Are you trying to get their hormone levels to when they were in their 20s?
No, not necessarily. Actually, 30 is usually an average age where you're nice and hormonally balanced. But it's about the person. And it's not about treating the lab test. It's putting them at the most optimal level they can be to keep them balanced so that they are symptom-free and that their risk of chronic diseases are lower.
How soon do people start feeling better, by the way?
Oh,
Women come in, their anxiety, depression, all the things you mentioned, hot flashes.
Let's just take testosterone, for example. If a woman comes in and she's got a really low testosterone level and you replace that testosterone, she gets her sex drive back, she gets her energy level back, she gets a sense of confidence back. It can affect her dramatically pretty quickly.
Okay, now with testosterone, let's start there. You mentioned the frequently or the commonly replaced hormones are what again?
Estrogen, progesterone, testosterone, DHEA, and thyroid.
Okay, so let's begin with testosterone.
Okay.
With women, what's it responsible for? I don't even think of women having testosterone levels.
Yes, women definitely have testosterone levels, and just like men, it's involved in our sense of well-being, just like it is a man's. Our sense of confidence and our motivation, and it's involved in our sex drive, as it is in men. It helps us keep that little flabby skin off of our arms. It doesn't help us build the muscle that men do, but it does help keep us toned. So a woman who's low in testosterone going to have symptoms of that loss of confidence, that lack of drive and of motivation. Frequently, women, you'll notice that they get tearful. And they've never done that before. And just like you don't see men getting tearful at work, because they have a high testosterone level.
Okay,
so
that's why we're not crying at work.
Ours isn't quite as high. Exactly, and ours isn't quite as high. And you drop ours, and you'll see those kind of things.
But does it help with motivation for sex? I mean, are there women that could come in and say, I'm just not into sex, and you give them testosterone, and now they're back mentally there?
That's the hormone that needs to be replaced. That's an easy one to fix. And there's a lot of reasons hormones go down. And with testosterone, you see it going down in young women because of birth control pills. So a lot of times, if it's a younger woman, that's one of the few things that's going on with her that you can fix and instantly kind of give her enjoyment back, with sex or interest. And
okay, so estrogen. What about estrogen?
Estrogen. Now, Randy, estrogen is involved in actually 400 functions in the female human body. And in fact, we have estrogen receptors or sites of action everywhere, absolutely everywhere. We have it in our brain, we have it in our eyes, our heart, our skin. It's involved in our digestion. It's involved in so many processes, not just our sexual organs. So estrogen is very important, and estrogen actually kind of declines about the age of 45 to 50.
Okay.
Starts its decline. And the symptoms we get with estrogen loss that's when your hot flashes come in, your night sweats, your fatigue, you're not sleeping, don't have much of an interest in sex, obviously, with all this going on. And the issue with estrogen loss, too, is all those symptoms, and women really suffer with these symptoms. You can't get away from
But
them.
is it really a problem with estrogen? I mean, when look in the limited reading, that I do anticipating this interview,
Yes.
with this whole estrogen dominance thing. I mean, is there a shortage of estrogen in women?
Sure.
Isn't that the least of their problems,
Well,
or no?
we
And
even-
isn't it dangerous? Can it grow cancers?
Well, let me tell you.
Okay.
Let's go back just to the estrogen. You asked about estrogen dominance. You will find women who have symptoms of estrogen deficiency, absolutely. And you have women who have estrogen dominance. Now, that doesn't necessarily mean that their estrogen is too high. It's just too high in relation to a very important hormone, progesterone, because progesterone actually starts to decline 10 years before estrogen does.
Interesting.
So
Okay.
that's where your estrogen dominance comes in. Not so much that you have too much estrogen, but it's not in balance.
Interesting.
Not in balance. And with estrogen dominance, their symptoms there are going to be sore breast, heavy menses, headaches. Again, they'll have decrease in sexual interest when they're estrogen dominant, and they're very fatigued. They gain weight, and the hot flashes will still occur even with estrogen dominance.
So when you hear now we're talking about bioidentical hormone or natural
Right.
hormones.
Right.
When you hear some of the negative things about hormones,
Yes.
they're not talking about natural hormones most of the
No.
time.
No, the confusion out there is amazing. There's confusion among the public. There's confusion among press, most certainly. They get it wrong a lot, and even doctors are confused. If you go out and ask 100 doctors and they're not trained in the specialty, they'll be confused. So the issue of whether it's safe really comes back to the WHI. Everybody's heard of it, and it's really where this confusion stems from. Those studies did in fact show that women on synthetic, not bioidentical, but synthetic hormones did have an increased risk of stroke, heart disease, blood clots. All those studies were done on synthetic hormones. This is in contrast to bioidentical hormones. Bioidentical hormones are molecule for molecule exactly the same. Randy, if I put up a picture of the molecule of progesterone and I put up the molecule of identical progesterone, you can put them in 3D and they're the same. Now, if you take a progestin, which is Provera, for example, and look at it, you can easily tell.
But they do work, though. I mean, those things. I mean, they take women, these synthetic hormones, no more hot flashes, things like that.
They do work. They do have some relief of symptoms. Not relief of all symptoms, but they do have some relief of symptoms, and they even help protect the uterus, but they don't have the protective capabilities. They do not balance estrogen like your natural progesterone does, and you need that for protection of your breast, and you need that so that you don't develop blood clots. These women on progestins develop blood clots.
So can they make the switch? I mean, are there still millions of women on these synthetic hormones?
They should make the switch.
Okay, but are there millions of women on these synthetic hormones?
Yes.
So if they make the switch, will they still have their lack of symptoms? I mean, they'll still feel.
Yes.
And the benefits
and they get the benefits of they're not going to be subject to the vasoconstriction, which causes blood clots, strokes. The natural progesterone will protect their breast.
Okay.
It protects their heart.
And the science is behind bioidentical hormones now. Is that right?
Yes.
I mean, is there a lot of scientific literature on this?
There is. I've been out there and looked. And that is why the whole specialty of the anti-aging medicine came about. There's been research being done for many years. It's just not got into the mainstream of our disease model-based business of medicine that we've all been practicing. So there's studies done all over the world, Randy.
So you mentioned estrogen. Okay, progesterone.
Let me talk a little bit more about estrogen.
Okay,
Just
all
one
right.
other thing before we go on to progesterone, because I think this is an important point.
Okay.
We don't replace estrogen by mouth. And there's a number of reasons for that. It decreases our growth hormone. That's our hormone of youth. We don't want to be dropping it down. It drops it by as many as 50 points. But even more so, it raises our liver enzymes. It increases our blood pressure. It increases our risk of blood clots. So we replace it on the skin. You can have it compounded by a compounding pharmacy in the exact ratio and amount that particular woman needs.
So it goes on the forearms. You just rub it in?
Rub it in. Easy as that.
Are there millions of
and
women
it works
taking it orally?
There are. And I
Interesting.
I think estrogen by mouth is very concerning. And I know some physicians do it. They know that there's risk and they inform the patients of the risk, but the patients are so miserable And if they think that's their only option, that's what they do. There's another thing that's very important to know about estrogen, and I will try to keep it very brief, but it's an important point. Women actually have three estrogens that is active in their body. That's E1, which is estrone, E2, which is estradiol, and E3, which is estriol. And we know that E1 can be very stimulating to the breast, and we know that it is associated with cancers, with breast cancer.
Interesting.
We know that estradiol is very protective. We need estradiol because it's protective on our memory, it's protective on our heart and our bones. We need estradiol. Estriol, E3, is a very weak estrogen, but it's very important because it is very protective of our breast. And experimentally, even now, is being used in the United States for breast cancer. But it's actually been used over the last 60 years in Europe for that purpose.
Okay.
And the problem happens at about that age of 45, when that estrogen starts to decline. It's not just the level going down, it's those ratios are reversing. So now, instead of having 10% estrone, the bad one, and 70% of estriol, the good one, that ratio is reversed. Now you got 70% E1, the bad one.
So you test for this,
absolutely,
and you could replenish.
Absolutely, and when I told you about putting estrogen on the skin, we give it in a ratio that puts that level back the way it's supposed to be. So when I prescribe estrogen, I will generally start out with estriol at 80% and estradiol.
So are you mimicking
20%.
like regular physiology of youthful levels?
Yes.
Is that what you would say?
Isn't that wonderful? Yes.
Okay.
Wonderful.
And the women start feeling better. So when women have these estrogen problems.
Yes. It's like giving them their life back.
Do they say that?
Oh, yes, they do. And it's just, imagine a woman who feels miserable, she's having hot flashes, she's fatigued, she's not sleeping, she's gaining weight, and nothing she does changes it. She's fighting with her husband at home. She's irritable and anxious and tearful at work. She's irritable with her kids. And you replace her hormones and balance her, and now, instead of wanting to strangle her husband, she has affection for her husband again.
Interesting.
So at work, she's got motivation. She gets up, she goes to work, she's active, and she can deal with her kids.
But this isn't just about stuffing people with hormones. And we've talked on the phone. You say, without nutrition, none of this will work.
Oh, no.
So you tell them what to eat on your program?
Yes, absolutely. Nutrition is critical. All these hormones and all reactions in the human body, all chemical metabolic reactions in the human body require cofactors. Cofactor can be a vitamin, a mineral, an enzyme, or protein. And if you are deficient in one of those, it will affect the development of that hormone. It will affect your body's ability to repair and grow. If I take zinc, for example, zinc is involved in progesterone, in thyroid, in estrogen. And if you get low on zinc, it's going to affect, of course, all those hormones.
We'll take a quick break. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We're talking about big topic, hot topic, balancing your hormones with natural hormones. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're discussing bioidentical hormones, natural hormones, with an expert on the topic, Dr. Vance. Okay, so you're fellowship trained in this anti-aging medicine.
Correct.
And your company, Advanced Health and Wellness Institute.
Yes.
Okay. And it says specializing in integrative and longevity medicine.
Yes.
And you think people are going to be living longer.
Oh, yes, I do.
You're convinced of that.
Not even longer, but better.
Better.
Like living
what?
better.
Like help me kind of wrap my mind around this philosophy.
Well, we're not just delaying. It's not just an issue of trying to delay these chronic diseases, but really is an issue of feeling good and looking good and being active. If you golf, you should be able to golf into your 70s and 80s. Golf into your 90s. If you want to garden, if you want to travel, if you want to play with kids, whatever it is you want to do, this is what this is all about. It's about feeling good and being free of symptoms.
Do you think there's women out there watching this, they're in their 50s, 60s, 70s, they go, well, I feel pretty good. Why would I want to do it?
Well, not that many, I think, are feeling that good. And some people, sometimes you don't realize how bad you're feeling. You kind of get used to the weight gain. You get used to feeling tired. You get used to not sleeping to a certain extent. So, if you actually kind of step back and you realize that maybe they don't feel quite as good as they thought, but also it's what we're trying to do is protect people from chronic disease. We want them to live happy, healthy, vital lives.
Okay, and you could do that through nutrition, replacing hormones. Let's talk about, and we're just about out of time, but progesterone, and I want to ask you about thyroid as well, but progesterone.
I love progesterone. It's one of my favorite hormones.
Okay.
Progesterone actually declines in a woman about the age of 35, long before estrogen does, about 10 years before estrogen does. And it has some pretty profound effects.
Like?
Not sleeping. For me, that was the biggest issue.
And that's a cream as well?
That's a cream as well, although if you're not sleeping, you can actually take progesterone by mouth. Okay. And it is a great sleep inducer. And
really?
Yes, it's a relaxing
better than
and a deep sleep. Yes, absolutely better.
Okay.
Yep. And you can take a pill, but it doesn't let you get into the deep natural sleep, the restorative sleep that you need. And when we balance our hormones, we get that restorative sleep.
Okay, so progesterone, aside from sleep, what else?
Well, it's involved when it starts to go down. Women start to notice those symptoms of their menstrual periods get heavy. They have a lot of heavy bleeding. They get real tired. They start to have weight gain. And the sore breast.
What about PMS?
Oh, PMS is terrible. And that's when you notice PMS. And if you'll ask women, when did your PMS get bad? They'll tell you. 35, 36 years old.
Really? Does it get worse?
Bad. It gets worse.
And does it go away in some cases, by the way? Oh, headaches, migraine headaches?
Headaches are even worse. You always think you're going to outgrow these migraine headaches, and you are very disappointed to 35, 36, 37 years old, and the migraine headaches are worse. And not only are they worse, but it's harder for you to deal with it because you're so tired and you're not sleeping. So when we replace progesterone, it's amazing. If you're low, absolutely. We don't replace.
So get your hormones checked. Is that your message?
Absolutely, it is.
What about thyroid?
Thyroid, there's a lot of symptoms that come along with thyroid, and it's a lot more common than you think it is.
Okay.
And it's a lot of reasons women can't lose weight. These women who have always been thin all their lives and no matter what they do can't lose weight. A lot of times it's thyroid. And it's like everything slows down because it is the metabolism. It is your growth and repair. And everything slows down. Your hair will slow down. You will even get lose the outer third of your eyebrows in some cases. You get very fatigued, very tired, very sluggish. Even your memory and your thought process will get sluggish. Your nails won't grow. They get thin. You get these cold hands and feet. You wake up in the middle of the night and your hands and feet are frozen, and you're just not circulating
cold hands, cold feet, that's thyroid.
Oh yeah.
Interesting.
Yep.
So thyroid, what's its connection with weight loss? The metabolism.
Huge connection. You're going to have a very difficult time losing weight if your thyroid is low. And if your thyroid is not functioning properly, that's why you get the symptoms, the cold hands, the cold feet, because everything is so sluggish. You're not circulating, you're not metabolizing. It's even why your cholesterol goes up when you have a low thyroid, because you can't metabolize your fats and your proteins and your cholesterol. So weight loss is very difficult.
Do these women come into you for weight loss, or as you say, it's a side effect? That means they come in to get balanced hormones, and then they lose weight.
I'd say it's more often, it's a side effect. They come in to get rid of these other symptoms, and the weight kind of has crept up on them year after year after year. And the weight loss is a nice side benefit, I'd say, of getting your hormones balanced and getting your nutrition.
So do you think the second half of your life, as they say, this cliche, that can be the best half of your life?
Yes.
Because of hormones and nutrition and all of this?
Absolutely. It's funny, we do all these things and we work and we struggle, and then we retire when we're 70 years old. And now all of a sudden we don't have the energy to do those things that we dreamed of. We dreamed of playing golf and traveling and playing with grandkids and gardening. We dreamed of doing all those things. And now we're 70 years old and we don't have the energy. Absolutely. By restoring our hormones to more youthful levels, by keeping our nutrition up, by delaying these chronic diseases, at 70 years old, you can do these things. You can play golf. You can.
Do people say that, though? I mean,
yes.
that their lives are changed because of this?
Yes.
That all of a sudden now they have more energy? But couldn't somebody argue, though, that even though they're natural hormones, bioidentical hormones, that it's not natural? You're still putting something on your skin, or what's wrong with aging gracefully?
Sure. Randy, this is no different than any other technology. You can take advantage of it or not. If you have a heart attack, you don't have to go and have a bypass.
Good point. Okay.
You don't have to. You can choose to have your heart attack and and whatever consequences come along with that. Yes, you can do that. Hormones are no different, Randy. This is a technology that you can either take advantage of or not.
Good point. Okay.
You can choose to grow old or age gracefully if that's what you want to do, or you can take advantage of replacing your hormones and keeping them balanced so that they can keep you young and vital. You can take advantage of the nutrition. We know more about nutrition today than we ever knew 15 years ago. And you can take advantage of what we need to do to keep you sleeping and stressed so that you feel good and wake up.
And that's what your program
excited.
is all about.
Absolutely.
Somebody watching this, a woman watching this, 40s,
Yes.
50s, 70s, I mean 80s, could come in and do this?
Absolutely.
What do you want them to know if they're skeptical?
Well, all they need to do is to give us a call, and we'll get started.
And they're going to meet with you?
They'll meet with me. They'll meet with me personally. We will take a very, very lengthy inventory of what their situation is, what their stress is, what their symptoms are, what their family history is, what kind of medications they take, and what kind of diet they have, what kind of toxins are they exposed to. And then we'll test.
Test for hormones?
Absolutely. We will test their hormones. We'll test those metabolites. They're very important. We will test their nutrition. We can even test, a lot of people don't even know it, we can do a nutrient test to test all their vitamins and mineral levels. Okay. And we can find out where they're deficient, and we can even have a custom made vitamin that is for them.
Okay, so on day one, and we really are out of time, okay, so you meet with them maybe an hour or so to go over their history. You get some hormone tests that you order. They come back a week later. You evaluate it, and then they get started.
Right. They get started, and they start feeling better, and that's our goal. And we make sure that they get better.
All right. Well, I want to thank you so much for coming on the show. Very interesting.
Thank you so
good.
very much, Randy.
Very good. You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or direct a friend to it, you can go to our website at wellnesshour.com. Just put in Dr. Vance or bioidentical hormones or natural hormones, and you'll find it there on our website. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.